Imagine if you could protect yourself from one of the most dangerous and deadly cancers affecting men today. Prostate cancer is a silent killer that takes thousands of lives every year. But it is a disease that can be prevented if detected early. According to the National Institute of Health, prostate cancer is the second leading cause of cancer-related deaths in men. The shocking truth is that 1 in 8 men will be diagnosed with prostate cancer during their lifetime. And in 2024, more than 30,000 men lost their lives to this. In 2025, just over 100,000 men are expected to face this diagnosis. But here is the good news. Prostate cancer does not have to be a death sentence. If you recognize the early warning signs and take action, you can significantly increase your chances of survival. The problem is that most men ignore the prostate gland until it is too late. The prostate gland is a walnut-sized organ in men located just below the bladder and in front of the rectum, surrounding the urethra, which is the tube that carries urine and semen out of the body. It produces and secretes a fluid that makes up about 30% of the volume of semen, which helps nourish and protect sperm cells during ejaculation. The prostate is also important for muscle contractions during ejaculation, highlighting its vital role in reproduction and fertility. In this video, we are going to reveal the first 12 signs and symptoms of prostate cancer that most people ignore. These subtle clues can easily go unnoticed, but recognizing them can mean the difference between life and death. So, if you are over 40 years old or have a family history of prostate cancer, this video is a must-watch. First, what do you need to know about prostate cancer? Despite its prevalence, many remain unaware of the early warning signs, leading to late diagnoses and more challenging treatments. Unfortunately, the silence around prostate cancer only increases its risks. When it comes to prostate cancer, did you know that age is the highest risk factor? The likelihood of developing prostate cancer significantly increases after 50 years old, and it is more common in men over 65. Here is the worst part. One of the most stealthy aspects of prostate cancer is that it can develop silently without any noticeable symptoms in its early stages. However, as attacks, it can cause all kinds of symptoms, from urinary problems to discomfort in the pelvic area. Being aware of these symptoms and understanding the importance of regular checkups can significantly increase the chances of early detection and successful treatment. Now, let's explore the 12 early signs and symptoms that can help you detect prostate cancer even before undergoing a medical test. After going through these 12 signs, we will also explain the common causes of prostate cancer so that you can reduce your chances of developing it. So don't miss this. Have you noticed blood in the urine during urination? This alarming symptom, known as hematuria, is a possible warning sign of prostate cancer. It can appear as a pink, red, or brown discoloration in the urine, and in some cases can only be detected microscopically. The presence of blood usually indicates advanced prostate cancer, making it extremely important to seek medical evaluation immediately. While other conditions, such as urinary tract infections or kidney stones, can cause hematuria, it is vital not to ignore this symptom. Early detection and treatment can help improve outcomes. Therefore, stay alert and proactive about any changes in your urinary habits. Number 11. Difficulty urinating. You have difficulty urinating. This symptom can appear in different ways. You might have difficulty starting to urinate, experience a weak or interrupted flow, or feel that your bladder is not completely empty even after going. Here is why prostate cancer can press on the urethra, making it more difficult for urine to pass smoothly. Number 10. Inability to urinate standing up. Imagine this. You go to relieve yourself but suddenly find it difficult or impossible to do so while standing. This uncommon change can be alarming and disturbing, suggesting a more serious underlying issues. When prostate cancer affects the prostate, it causes the gland to grow and increase in size. This enlarged prostate can press on the urethra, blocking the flow of urine. Result: some men may find it difficult to urinate standing up and might choose to sit instead of going. Because of this. 9. A noticeable burning sensation when urinating or during ejaculation. You feel a burning sensation when urinating or during ejaculation. This discomfort, which can range from mild to intense pain, may indicate that cancerous growth in the prostate is irritating or blocking the urethra and nearby tissues. Here is an interesting fact. This burning sensation is not just distressing, but it can also indicate inflammation within the prostate. While other conditions such as urinary tract infections or prostatitis can cause similar symptoms, it's important not to dismiss prostate cancer. Persistent burning during urination or ejaculation requires immediate medical attention. 8. Frequent urination, especially at night. You often find yourself waking up to go to the bathroom, which leaves you tired and restless. Urinating frequently at night, known as nocturia, can disrupt sleep and lead to chronic fatigue. Although it is normal for bathroom trips to increase with age, a sudden or noticeable increase should not be ignored. Since prostate cancer causes the prostate gland to enlarge, it can press on the bladder and urethra. This pressure can lead to an urgent need to urinate more frequently, especially at night. You may wake up multiple times, disrupting your sleep and feeling increasingly exhausted during the day. But before we continue, if you are enjoying this video and want to stay informed about important health topics, don't forget to hit the like button and subscribe to our channel. Your health is worth it. Unexplained weight loss. Did you know that unexplained weight loss can be a subtle yet concerning sign of prostate cancer? This symptom is often overlooked, as it can be linked to other factors like stress or changes in diet. However, if weight loss occurs without any intentional changes in your eating or exercise habits, it is important to pay attention. Prostate cancer can cause unexplained weight loss, particularly in the advanced stages, when the cancer has spread to other parts of the body. This is because the increased energy demands of the body and the effect of cancer on metabolism can lead to significant weight loss. Number 6. Bone pain. Another concerning symptom to watch for is bone pain. Often this pain is persistent and not linked to any obvious injury. Here is an explanation of why this is significant. As prostate cancer progresses, it can spread to the bones, causing considerable discomfort. This type of pain is typically felt in the spine, hips, or ribs, and can range from a mild nuisance to a sharp stabbing sensation. The interesting part is that bone pain associated with prostate cancer does not go away on its own, and it could be a sign that the cancer has reached an advanced stage. You always feel tired, even on days when you haven't been busy. This can be a subtle sign of prostate cancer. Fatigue can gradually increase or hit you suddenly with full force. Fatigue in prostate cancer is not just about feeling sleepy. It is an incessant tiredness that does not improve with rest. Here is the worst part. Cancer-related fatigue is often more severe than the typical tiredness you might feel after a long day. It is caused by the body's response to the cancer itself. Cancer, due to the energy demands of tumor growth and sometimes as a side effect of the treatment. Blood in the semen. Imagine the shock and concern upon discovering blood in your semen. This disturbing situation can leave anyone feeling vulnerable and anxious. Known as hematospermia, blood in the semen can be linked to prostate cancer, as the cancerous growth within the prostate disrupts delicate tissues and blood vessels. This intrusion can lead to blood leaking into the semen, causing a pink, red, or brown. Hematospermia can also occur after treatments for prostate cancer, such as radiotherapy or surgery. However, if you frequently notice this symptom, consult your doctor for a complete evaluation. Weakness, numbness, or tingling in the legs or feet. Did you know that prostate cancer can sometimes cause symptoms that seem unrelated to the prostate glands? One of these symptoms is weakness or numbness in the legs or feet. This can occur if the cancer spreads to the spine, pressing on the nerves that control the legs. When this happens, men may experience weakness, numbness, or tingling sensations in the legs or feet, making it difficult to walk or maintain balance. In some cases, the symptom can be so severe that it leads to paralysis or loss of bladder and bowel control. Pain and discomfort in the pelvic area, lower back, or upper thighs. The human body is a complex network of interconnected systems, where problems in one area can affect the whole. In the case of prostate cancer, the pain and discomfort in the pelvic region, lower back, or upper thighs highlight how the body is truly interconnected. When prostate cancer spreads, it not only affects nearby areas but can also impact the bones and lymph nodes. This aggressive spreading causes inflammation and swelling, which puts pressure on sensitive nerves. As a result, the pain radiates from the pelvic region to the lower back and thighs. Are you having difficulty maintaining a consistent erection? Erectile dysfunction or impotence is the inability to achieve or maintain an erection firm enough for satisfactory sexual intercourse. Although it can be caused by various factors, it can also be a sign of prostate cancer, especially when it occurs without an obvious cause. Here is the problem. Treatments for prostate cancer such as surgery, radiotherapy, and hormone therapy can damage nerves and blood vessels that control erections. This can lead to erectile dysfunction, even if the cancer itself is not directly causing it. So, what are the causes of prostate cancer? Understanding this can greatly increase your chances of preventing this serious disease. Let's explore what they are. What causes prostate cancer? Prostate cancer is a complex disease with several contributing factors. Essentially, it occurs when changes happen in the DNA of normal prostate cells. These changes can occur during a person's lifetime or be inherited from their parents. Here's an interesting fact. Inherited genetic mutations can contribute to up to 10% of prostate cancer cases. Genes like BRCA1 and BRCA2, which are commonly associated with breast and ovarian cancers, can also increase the risk of prostate cancer. On the other hand, acquired mutations occur randomly as cells divide and copy their DNA. These mutations can lead to uncontrolled cell growth, forming a tumor. Think of your DNA as a set of instructions for your cells. When there is an error in these instructions, it can cause cells to grow uncontrollably, leading to cancer. But that's not all. There are other unexpected factors that can increase the risk of developing prostate cancer. Let's explore them. First, obesity and diet are other factors to consider. Men who consume a diet high in fats, especially rich in red meat and high-fat dairy products, may have a higher risk. Diets rich in fruits and vegetables can decrease the risk. Environmental exposures and lifestyle choices, such as smoking and alcohol consumption, can also contribute to the risk of developing prostate cancer. Race and ethnicity also play a role. African American men have a higher risk of developing prostate cancer compared to men of other races. Furthermore, men with a family history of prostate cancer are at higher risk. This means that if your father or brother had prostate cancer, your risk is more than doubled. However, understanding the causes and risk factors of prostate cancer is not enough to keep you safe from this disease. Let's find out the best way to prevent prostate cancer. How to prevent prostate cancer? While there is no foolproof method to ensure immunity to prostate cancer, there are several lifestyle changes and health-conscious habits that can significantly reduce the risk of developing the disease. 1. Adopt a healthy diet. Since you are what you eat, it is advisable to choose a balanced diet full of fruits, vegetables, and healthy foods. Here is a fun fact. Incorporating foods rich in lycopene, like tomatoes, and omega-3 fatty acids found in fatty fish can provide an extra layer of protection. 2. Maintain a healthy weight. Did you know that keeping your body mass index or BMI within a healthy range can reduce the risk of prostate cancer? In fact, losing extra pounds and avoiding obesity can further increase your chances of preventing prostate cancer. 3. Stay physically active. A sedentary lifestyle is a major risk factor for many diseases, including prostate cancer. This makes physical activity essential for your health. Start by including regular exercise in your daily routine. Aim to perform at least 150 minutes of moderate aerobic activity each week to help reduce the risk of prostate cancer or have regular checkups. As mentioned earlier, the best part of being proactive with your health is the peace of mind that comes with early detection and treatment. Consult your doctor to determine the right age to start annual prostate exams based on your individual risk factors. Remember, early detection is essential for effective prostate cancer treatment and for a better quality of life. Do not ignore the signs mentioned in this video and listen to your body so you can act when something seems wrong. Make sure to schedule regular checkups with your healthcare professional. Maintain a healthy lifestyle and stay informed about the risks and symptoms of prostate cancer. And if you found this information useful, don't forget to like, subscribe, and share this video with your friends and family to spread awareness about prostate cancer. Comment below and let's start a conversation.